Welcome back. Just the thought of braces can turn a smile upside down, but orthodontic specialist Dr. Thomas Tipton is here to tell us about new technology that can improve smiles faster and with fewer visits to the dental office. Thanks so much for being here.
Well, thank you.
And who'd you bring with you today?
We brought Madeline and Olivia, and they are my daughters, and they also work in the office.
Okay, terrific. Now, first of all, let's talk about your training as a specialist.
Yes, I went to the Washington University in St. Louis to dental school, as most orthodontists do. They have to go through dental school, and then they receive specialty training, and I went to the University of Pittsburgh for 2 years to do my orthodontic residency. In between that, I also practiced general dentistry for a few years. And now I've been practicing orthodontics for 20 years in the East Valley.
Okay, and you have the latest technology. Let's talk about this with braces.
Yes, there's some tremendous new technologies. In the last 10 years, we've come into the digital revolution, and all offices do their records, their x-rays, and their photographs digitally. But in the last couple of years, we've come into a new revolution, and that is the revolution of three-dimensional technology combined with robotic technology.
How does that work?
Well, a lot of people, when you say robotics, think that robots are going to work on your teeth, but that's not true. What happens is traditionally orthodontists used to, or they still do, they place braces on the teeth, and braces are really nothing more than just a handle to move the teeth. And then they'd have the patient back, and they'd tweak the wire, they'd bend the wire in order to move the teeth. And they'd go back and forth. Every 6 weeks they'd bend the wire. And it's kind of a trial and error process and takes a lot of visits and a lot of time. Well, today what we can do is we have the patient in and we do a scan. And Maddie, and actually Olivia, has a scanner we'll show you in just a minute.
Okay.
And this scan will produce a 3D image of the patient's teeth and braces on the computer screen. We send that, in that image I can manipulate. I can actually move the teeth into precise positions on the computer screen. And then we send that data to Dallas, Texas, to a company called SureSmile, which is a revolutionary company. The robots at their company then bend the wire, and the wire then is sent back to us. We place it in the patient's mouth, and it moves the teeth into precise positions.
And obviously, you would say that's more effective than traditional braces.
It's more precise and it's faster. Of the 200 orthodontic offices across the country that are using it, we're finding that it's speeding up treatment by about 40%.
All right. Now, Maddie and Olivia, you probably see a lot of patients come in and get this procedure done. Do you think braces should be done with SureSmile?
Yeah, I think it's a really good technology because I had my braces on for 2 years, and I could have gotten a year if I had SureSmile.
Oh, wow. And that makes a big difference, doesn't it?
Yeah. I've seen a lot of the results in my dad, Dr. Tipton's office, and they're fantastic.
Okay, terrific. Now, of course, a lot of people want SureSmile, and you also have special wires. So explain that to me.
Exactly. The wire that Maddie is holding is a wire that the robot has bent. You can see that it has, I don't know if you can get a close-up, but it has bends in the wire. And at room temperature, actually a little bit cooler, that wire will just come straight. And it's not actually activated. The bends are not really, you don't see those until it's placed in the mouth, and the mouth temperature then causes that wire to bend. And that's when the movement of the teeth starts.
Okay, and you don't have to go to the dentist as much, I understand.
That's right. Exactly. Yeah. And some of the other advantages are there are less side effects from having this treatment. Fewer, less decay, less decalcification of the teeth, scarring of the teeth.
And less time on the teeth, just like you guys said.
Exactly.
All right. Well, thank you so much for being here. Thank you all so much. And
thank you.
To learn more about this technology, you can go to tiptonorthodontics.com. You see it on your screen, or call 480-813-8610.